Hey everyone, I hope you're all well. I've done a collaboration with Patients Can to write a guide for patients that have a prescription that also claim for social care, and it is a guide to help patients to submit their medical cannabis expenditure as disability-related costs to try and get your social care charges reduced. So this isn't for anyone that doesn't have a social care package, and this isn't a way to get your prescription paid for by the council. They're not going to pay for your prescription, but they will reduce your social care charges, which will then enable you to afford your prescription. So I hope that's clear. Social care is delivered in a couple of different ways in the UK. The first way is through a care agency, and that's when your council provides a package of care via a care agency, and the council are choosing the care agency and delivering it, and you as the disabled person receives the care, but you don't have any autonomy over which carers you see, what times they come, things like that. So it's not a very independent way to receive care, but it can suit some people. And then the second package of care is called direct payments. And direct payments is when the council agrees a social care package, and then after they've agreed that, you as the disabled person, you choose your care provider. So you can either choose a care agency yourself, or you can choose individual carers, and you can choose the times they come, the days they come, and you have a lot more flexibility over your care than you do if you have a care package where you don't have any control over the carers. So the one that I have is direct payments, but whichever care package you have, when you first get a social care assessment, they will assess you on your disabilities and your care needs. And then once they've worked out how many hours of care you need per week, then they will do a financial assessment. Anything that you get paid to provide work for, they disregard. But what they do accept as income is all of your universal credit or ESA, and then the whole of your care component of your PIP or your DLA. They disregard the mobility portion of it, but they take your care component as income. So in theory, you could have all of your care component of your PIP taken away for social care charges. And they also set something called the minimum income guarantee each year, which is the minimum amount that they see a disabled person needs to live off. And it's very modest, so they disregard that. But what they don't tell you when you have a social care assessment is that you can apply for your disability-related costs, which is called disability-related expenditure, or DRE. You can apply to have these costs accepted as legitimate disability spending, and therefore have your care costs reduced. But it's not an easy process. The council's bound by the Care Act 2014, which states that claimants of social care should be able to look after their well-being, and the well-being is the buzzword of the Care Act 2014, and that includes various aspects such as social inclusion, and if your care charges are so high that you can't afford your prescription, your well-being is going to be affected, and that's a breach of the Care Act. So this is something that you can use to fight your case if the council doesn't accept your medical cannabis as DRE. So the important thing to do is to provide proof of the costs. So you need to send in bank statements or invoices of anything that you spend on medical cannabis. But the most important thing is to provide medical evidence as to why you need your medical cannabis, as opposed to a cheaper prescription-based medicine that you could get on the NHS and therefore wouldn't have to pay your medical cannabis costs. This is what the council is going to challenge you on. They're going to try and argue that there are other medications available, be it for chronic pain, mental health, epilepsy, whatever your condition is. They're going to argue that there's other alternative medications, so you need to put in as much evidence as you can to support your claim. And for me, I submitted evidence that opiates were risky for me with a severe bowel condition as a way to prove that alternative pain relief isn't available for me. But the other hurdle that I fell down at, and a lot of patients do fall down at, is that a lot of councils don't want to accept evidence from your medical cannabis prescribing clinic. So they insist on a GP providing supportive evidence. And this is a problem because not everybody has a GP who is pro-medical cannabis. For me, I went to the GP who wasn't my named GP, but he was the one that oversaw my opiate reduction, and he supported me and sent in the medical evidence. So I think it's always good to have a GP who is pro-medical cannabis, but if your actual GP isn't supportive, try getting some supportive evidence from a different GP or from your consultant, because my rheumatologist also supported me and said that he was so impressed that I'd come off all my pain meds that he supported my case. So I think that's the most important thing, is to provide really good supportive medical evidence. But if the council refuses to accept your medical cannabis as DRE, you need to follow the process of making a formal complaint via their internal complaints procedure for your local council. And then once you've got the response, then if they haven't accepted it as DRE, then you can open a case with the social care ombudsman, who will independently assess your case. And the ombudsman are looking to see whether your council has breached the Care Act. If they have, then they will recommend remedies for the council to implement. And the remedies aren't legally enforceable, unfortunately, but councils rarely do refuse to comply. And if they do refuse to comply, they have to have an article in the local paper which mentions why they are refusing to accept this. It doesn't normally get that far. And then if they accept it, then they have to reduce your care charges. And for me, it meant that my care charges went down to zero because they failed to consider my medical evidence. So they failed to consider the fact that opiates are not an alternative pain medicine for me. And also they tried to claim that my medical cannabis costs were unreasonable, but they didn't give any explanation as to why they thought that. So the ombudsman ruled that there was a lack of transparency and there was an injustice to myself. So that's how I got my care charges reduced down to zero. So I'm really hoping that this will help anybody who gets social care or is about to get a social care package. And if you know of anybody who gets social care and has a medical cannabis prescription, please share this article with them. I'll leave the link in the description below. And yeah, that is that. Hopefully it will be helpful for patients. So I will speak to you all soon. Take care.